It is extremely important that when workers enter a confined space, that emergency procedures and first aid are established prior to that entry. Hi, it's Laurie from Total Management and Training. We have been involved in the determination or development of confined space entry procedures, provision of training and identification of confined spaces, and the development of emergency procedures for confined spaces for many years. When things go wrong in a confined space, people may be exposed to serious and immediate danger, so it is important that we have procedures in place and practiced prior to that entry. Effective arrangements for raising the alarm and carrying out the rescue operations must be established and are essential. In developing emergency procedures, it is important that we consider each of the following. The first is the location of the confined space. What's its geographical location? Is it close to ambulance? Is it close to fire brigade? Our first aid facilities are available. All of these need to be considered. Communications. How do they communicate from within the space to a standby person if an emergency situation occurs? How does an individual raise the alarm with a standby person if they're in the confined space on their own? If there is an emergency out of hours on site, can emergency services such as the fire brigade access the site? What sort of emergencies can occur in the confined space? Can a person collapse? Is it possible for a contaminated atmosphere? We need to consider things like rescue equipment. Does the individual need to wear self-contained breathing apparatus? Does the rescue person need to have access to self-contained breathing apparatus? Do we need to have a tripod in place? Does the worker need to be attached to a harness? All of these need to be considered in the rescue procedures. What training has been provided to the rescuers? Have they been trained in all of the rescue equipment? Do they know how to use the harnesses? Do they know how to use tripods? Do they know how to use their self-contained breathing apparatus? What first aid responses are available? Are all the rescuers trained in first aid? Do they know how to use the AEDs? Are AEDs available? Have the local emergency services been advised of the type of confined spaces you have in your workplace? Have they got the capabilities of recovering somebody from a confined space? Are they going to be able to provide you with assistance, or do you need to have your own emergency procedures without dependence on emergency services? Thank you for watching this video. If you would like further information on management of confined space entries, please look at our other videos, completion of a confined space entry permit and training of workers in confined spaces.